putting, in fact, two fibers in to each home in the area, along with full capability for HD video, a series of smart health appliances that are associated with both clinical as well as medical research activities. There are no requirements for any of the residents, about a third of whom are actually university students. That is to say that they do not participate in any of the research activities, but those that are engaged are IRB approved. That is to say, go through formal institutional reviews. We also, when you want to come visit us in Cleveland, welcome you to our open Alpha House, which affords you a chance as a visitor, and we've had many, it's nice to say. In fact, later today, some folks from Saudi Arabia are here, and we'll be walking them through a kind of demonstration home. Again, the format of the Case Connection Zone, we have a chief scientist. You can see Marv's mugshot there. We have a chief wellness officer. We're about to appoint a chief sustainability officer. These are people who aggregate the research activities and are customer, in this case, residential relationship managers to the communities around University Circle, focusing in on this connected, smart, safe, healthy, and green strategy. We are doing a lot of work in smart grid activities, focusing in on energy activities coming out of our engineering faculty, a number of startup companies that are now actually several of them, Aclara, which is noted in the upper right-hand side. Actually, you folks in California are quote-unquote enjoying their smart metering technology. If you're a P&G customer, they have all of California's P&G smart metering contracts. That came from a company here in Cleveland, actually students from Case Western Reserve University. We're working to connect all of the homes in the connection zone to the grid infrastructure for essentially two kinds of use cases that we're interested in. One is on the demand side, which is essentially what happens inside the home. We have, again, some interesting startup activity. Once we announce the connection zone, students really working on creating devices that are meaningful to residents, many of them low-income residents, to be able to manage their own environment and to be able to compare their consumption of energy with their neighbors. That's certainly an important part of behavioral change, and we have a research program associated with studying the behaviors of residents once they have visibility to the consumption of energy. We are also using that same infrastructure for a number of other vital readings in the home associated with, as I'll speak in just a moment, environmental health issues. In other words, this thermostat that you see here is actually gathering also humidity and will soon be gathering other censored air quality particulates as part of the in-home demand side effort. And that talks to a cloud service that connects itself to two of our energy providers here in the Cleveland area. On that energy, on the supply side, the goal again is to be working with really a cluster strategy that we have here in Northeast Ohio for being able to develop everything from software tools to actual component parts for smart grid activities and piloting those activities here in the Case Connection Zone for everything, including smart dynamic reprovisioning of power to subsections of the grid. This is actually one of the guys, if we had the whole morning, I'd be sharing with you. Dave's a Case alum. He's the guy who actually created the demand side, the software tools, and he's off to the races with some early stage angel funding on this project, including our investment here at the university in the Case Connection Zone to connect about a dozen of the homes as early beta testing of the software tools. The second use case has to do with health and wellness. And again, the goal here, although we are in many ways a mecca for health visitors from all over the world, to the Cleveland Clinic, university hospitals, Metro Health, and the VA, the condition of the neighborhoods around us is really in a state of health crisis. We are focusing in on a series of both wellness activities and chronic disease management, which is really a major issue here. Not only type 2 diabetes, as I already referenced, but a range of pulmonary conditions, hypertension, and the like. And each of these have sponsors inside the Case Connection Zone. We have a wellness program where we have an initiation to actually, again, educate residents on how to actually take care of their own health vitals and actually be able, through an electronic medical record like Google Health or the Microsoft Health Vault, to really be able to monitor their own environments. The Cleveland Clinic actually has a project with Google called My Chart. I'm actually myself one of the early beta testers of this, in which not only am I reporting my vitals through many of these devices, but I'm also being able in real time to monitor my own conditions well in advance of when the doctor or any of the other healthcare professionals gets to see it, and all kinds of rules have been written to send off flags when we have conditions that are important to be attending to. We also have a series of, as I noted, chronic care situations where we are using quite a bit of HD video conferencing, as well as a series of other monitoring tools. We use blood pressure cuffs and glucometer readings, which are really preparing residents for being able to have real-time data sent to the EMR, to the electronic medical record, and the healthcare professional. And we're finding enormous efficiencies. Literally, the factor of savings here is tremendous. To avoid an emergency room visit. One emergency room visit a year actually pays for one full year of use of our chronic care infrastructure, and obviously that's a very important economic driver for continuing to expand this activity. As I mentioned, we also have a number of environmental health sensing projects that are funded through the National Institutes of Health, and we are again using the Case Connection Zone for creating new sensors that are reporting back to an ongoing dynamic database in the school of medicine that is gathering information on what is going on in the homes. Cleveland happens to unfortunately have a huge amount of challenge with respect to lead poisoning in the air, and that monitoring now is one of the programs that is being funded to take a look at, again, real time, as well as, again, being able to present that information to the homeowner, the resident, in as much close to real time as we can. That was a small little example which you saw in the video of a resident really sitting on her park bench. You don't see her two grandchildren very well on the right and on the left, who are actually working with her, educating her on really kind of how to take advantage of the pressure cuff, and she's talking to Dr. Sadler on her nutrition issues with respect to her management of her type 2 diabetes. There is a whole series of learning use cases that we're working in, very much focused in on science and technology. There's a huge coalition of the willing, trying to improve success of students, both focusing in on peer-to-peer, as well as peer-to-mentoring, individual-to-mentoring relationships, not only in the university and the formal education environment, but like you, we enjoy a wonderful science museum community, and also a huge number of technology partners who are very much interested in improving the quality of the high school graduating science students, and we focus in very much on trying to partner in that environment. We do a huge amount of education media content for science through a partnership with One Community, which is called One Classroom. It's an aggregation of science content, curated science content for learning that is delivered both to our classrooms through One Community, as well as directly to the homes of both teachers who live in the Case Connection Zone, as well as families. We also do live programs with our healthcare providers. This is a very quick slide in which, again, we had a bit more time and actually run the video for you, in which a live surgery is going on at the Cleveland Clinic. This one happens to be a live heart surgery, and it's not a passive watch the surgery in the way TV used to present. This is live interactive HD video, not only into the surgical theater, but also right down to the probe surgeries going on. It's an academic program that's tied to AP biology here that is now being exported to the Fremont community, actually all over the nation to high school students, coordinated through the Cleveland Clinic's Civic Outreach Program. We also use, as was noted, a lot of concurrent HD video streams for teacher to student interactions. This one happens to be a demonstration of 2 high school students and 2 PACE students working with a faculty member on chemistry. There is, just to kind of try to come to the conclusion of my remarks and try to keep us generally on time, there is underneath all of these use cases a series of innovation targets appropriate very broadly to we in the information technology world, very much focusing here on leveraging the next generation, if you will, of Internet of Things, connecting embedded systems to each other in the grid and in the home, associated with a wide range of new sensors, and trying to even encourage some new middleware that we're working on with a number of other researchers across the country engaged in this kind of activity, and lots of new kinds of form factors. This is another startup activity that this gentleman, Modi Abisar, created. He's a fighter pilot simulation specialist who came to Northeast Ohio to work with Lockheed Martin on the F-16. He's now working on, as again you may have heard briefly in the video, a program called Surgical Theater, in which surgeons who are doing open brain surgery have a chance to practice with real patient-specific information. Their patient that they're doing surgery on tomorrow morning, they can actually simulate the aneurysm clips that they'll be using, in which they have literally 4 minutes to use the right clip to begin the surgery, to stem the blood flow before they take on surgery. This particular application is a very fat application because it is using real-time data from their patients and giving them a chance to use simulators to run those pre-surgical experiences. And I would say, sort of just in conclusion, that we have been up and running for just about 18 months now. We have a number of other communities blocks, if you will, gigabit beta blocks under design. We have from the beginning, again, just to tie it back to my opening remarks, tried to use this engagement as a way of bridging, and rather than a town-gown issue of trade-offs between what the university does and what the community around us perceives us, we've tried to create an and/both statement around committing to research and community priorities, very much focusing on attracting and catalyzing new, never-before-seen products and services, which I'll mention in just one more minute, an opportunity to engage, and really focusing in on those public sector services, education, safety, and energy consumption, and the like. Just to sort of just offer you a little insight on what's coming next, and hopefully this will spur some